Hello and welcome to Valid Points, powered by Validation Institute. I'm Mabel Jung. Capital RX, a healthcare technology company disrupting the way prescription drugs are priced and patients are serviced, meets Validation Institute standards for savings and contractual integrity. Validation Institute determined that groups using Capital RX for their pharmacy benefits solutions do, on average, experience lower costs per member per month. The company, based in New York City, services over 2.4 million members for Medicare, Medicaid, and commercial plans. I spoke with CEO AJ Loiacono about the company's technology platform, Judy. You spent the past several years building price transparency and claims processing software. You named the technology Judy. How has Judy made prices for prescription drugs more transparent and made prescription claims processing more efficient?
What Judy does, and Judy is short for adjudication, and she's the brains of our organization, is that Judy is allowing us to be agnostic on price. And what that means is to take a distributed model on pricing. So we offer, obviously, our benchmark rates. We use NADAC pricing, not to get too technical, but it's a pricing benchmark used by CMS. It's used commonly for Medicaid reimbursement in about 40 plus states. But the whole point is we're not in the price setting or the price fixing business. By not having, for us, an allegiance to one specific area, you can take a distributed approach, which is this is our pricing. Here's pricing from other parties. And in real time, our Judy platform can help you determine what's the best price. And the second part of Judy, which goes to claim processing, is the more efficient you can administrate a plan. So when we built Judy, unlike our competitors that scale with people, which is quite costly, Judy is a true modern enterprise platform. So all of our work streams and all of our departments operate on Judy hyper efficiently. And what does that do? It brings down the cost of healthcare, because if our administrative cost is effectively 1/8 to 1/5 our various competitors, we now have the ability to do more at a lower price point.
When payers and health plans started working with you, was the impact pretty immediate from the work that Judy was doing for them?
So price is an instantaneous event. So I have clients that are Fortune 500 companies that typically were using very big carriers and big PBMs, and they switched to us. And there were many consultants that would say, you can't do better than the large incumbent carriers and PBMs. And lo and behold, on their first invoice, year over year, it was lower.
Mm-hmm. As you spread your message, why was it important to get validated? You went through a process with the Validation Institute to confirm what you're saying. So what did they confirm when they reviewed your contract and your client's cost trends?
A lot of people will say, oh, I've heard this before. I've heard the empty promise of change, evolution, better results. And so you want to have a third party validate. It's easy for anybody who's selling a product or a service to say mine is better, but it's always helpful to have a third party validate that point.
First, it demonstrates a company's ability or commitment to transparency with their customers.
Benny DeCecca leads Validation Institute.
We had the opportunity to analyze 10 groups of their customers that have been with them for at least 3 years. It had around 400 members to 22,000 members per group, and it revealed a remarkable savings. The first year alone, these groups experienced an average savings of 14%, and some achieved exceptional savings of nearly 40%. This exceptional cost reduction is a testament to Capital RX's ability to significantly reduce the cost of pharmacy benefits management to their customers.
Sohn Health, a clinically integrated network focused on population health, experienced those cost savings firsthand.
Yeah, I would say it was a black box entirely. We really didn't understand our pharmacy spend or even the drug utilization. And utilizing CapRx has certainly added more transparency to the process and a little more predictability, as predictable as it can be when it comes to pharmacy expenses. And what we're finding 10 months, almost 11 months into the relationship is for our employee population, and our pharmacy spend is down $19.55 per member per month, which is phenomenal. So the proof of concept and the validation helped, and hopefully we'll continue to see that type of spend difference by the end of the calendar year.
For more information on Capital RX and Validation Institute, go to validationinstitute.com. Thanks for watching. For Valid Points, powered by Validation Institute, I'm Mabel Jong.